Thanks for joining us. It's Thursday at 4 o'clock and time for AirSculpt TV. Today is about revisions. What does that mean? It means you've had body contouring of any kind done before and you're not happy with the result, and we're going to fix it with AirSculpt. In fact, I'd say almost 50% of our patients have had something else done that we're fixing on any area of the body. Today we're going to talk about a patient in Seattle who had a tummy tuck, and she had liposuction 2 separate times. She was unhappy with liposuction. She found out about AirSculpt, and after 2 lipos, that's what she looked like, and this is how she looked after AirSculpt. So we're going to interview her, and she's going to talk about her experience having been through all this, and then we're going to answer some questions that we've been asked about fixing work that's already been done before, fixing all kinds of things, and we specialize in that. So I'm looking forward to answering those questions. Now we're going to go live to Seattle, Washington, and Bellevue actually, and we're going to interview Dr. Bullis, her AirSculpt surgeon, and Karen. Hello.
Hi. Hey everybody. How are you doing, Aaron?
Hi.
Thank you both for allowing us to interview you. It's an honor. Thank you, Karen, for being willing to tell your story, and Dr. Bullis for helping us out here. I appreciate you both very much. So, Karen, I want our viewers to hear your story from the beginning. So, before you had anything done, so tell us what you had done and how you felt and what happened.
Well, originally I had gone through a divorce and I wanted to get a tummy tuck because I had a lower belly pooch and I wanted to get rid of that. So when I woke up from the surgery, I had a flat lower abs and I had a large upper ab. And it turned out I had a massive infection afterwards and a lot of scar tissue.
Oh.
So after, that doctor said he really couldn't do anything, I just tried to diet and exercise and try to lose weight, but I couldn't figure out what was going on and why I still had an asymmetrical stomach. And then I finally saw Dr. Bullis for traditional liposuction, and he did an x-ray and he said it's just fat underneath. We'll try to lipo the hell out of it. We'll try to get that fat underneath the upper abs. Well, he tried twice, and just because of the instruments and the larger cannulas of traditional liposuction, he was not able to really fix that problem. And it just really bothered me. I was very self-conscious. And one day we're talking, and he started talking about how at AirSculpt, he's got this great, technique where he can blast through scar tissue. And I said, well, wait a minute. Do you think it's worth us trying a 3rd time? And he said, make a consultation at Elite, and we'll see. And we did, and here I am today because I am so happy that it all worked out. That I finally got rid of that fat.
Yeah, that's
amazing. That scar tissue.
That's hearing that makes me so happy because it shows even with the same doctor, different technology, different result. So
that's what I was. And when I first, just to chime in, I wasn't even really trying to sell her on this. We were just talking about something completely unrelated, and she happened to ask me, "How do I like things over at Elite?" And I started going on. I'm like, "Hey, I love the AirSculpt. I am drinking the Kool-Aid 100%. It is getting through scar tissue. It's getting fat out that I couldn't get out before." She's like, "Do you think it get through my scar tissue?" And I was like, "Oh, that's right. I forgot you have that." And for sure. It did and it's like butter. For any doctors out there listening, I just think this is the bomb for getting fat out.
Thank you so much. So, just to reiterate, we only do AirSculpt at Elite Body Sculpture locations. So, only Elite surgeons do AirSculpt. But, okay, so Karen, and I want to know what it felt like, the difference in the experience between traditional lipo and AirSculpt.
Well, traditional, it was very painful. And the recovery time is long. It's either anywhere from 6 to 12 weeks recovery time. I don't think I could exercise for at least 6 weeks. I had to wear the garment for I think 8 to 12 weeks total, and it's just painful. The recovery time is very slow, and I play tennis, and I have to plan it around the time that the downtime from tennis, and it's really hard, not to be able to exercise and to get back to doing what you love.
Okay, yeah, I'm sorry to hear that. And then what about the AirSculpt experience? How painful was that, and what was the downtime like?
Oh, the downtime was very minimal. I felt great the next day. It didn't hurt very much. It was nice to listen to music. It was like a day at the spa. I went to work a few days afterwards.
Wonderful.
It took 2 weeks. I could exercise again. And it was only about 3 weeks I could start to get back on the court and play tennis. And that was really great.
That's what this is all about. No one should have to go through any kind of serious downtime to have their body sculpted. That's one of the most important things about AirSculpt and this company. My favorite part about this is the result. So, Lauren, let's show the result a little bit better. And okay, so here we're going to post this, everyone. But you can see this is her front picture, before and after, and and here's her side picture, which is fabulous. Look at that tummy, and look at that lower back curve. How is your butt looking these days, Karen?
Oh, my butt looks a lot better.
I like what I see here. It's sculpted.
Yes.
Beautiful. And actually, let's look at the back view now, Lauren. Let's see. So look at the difference here, guys.
Yeah.
We have our logo for a reason. Our logo is this shape because that's
right.
You're fully hourglass now.
She's only 2 months out. I think she's still going to get some improvement.
It's only been 2 months, huh?
Yeah.
You're even going to look better in a month.
I know.
Yeah.
That's what I've been trying to achieve, hourglass.
Yeah, that's what everyone's trying to achieve. I love how your waist looks. Your waist, your tummy's flat. And by the way, I want to give Dr. Bullis credit here. Doing AirSculpt after doing any kind of body contouring after someone's had it 2 other times before, it's extremely hard. It's like fixing someone else's Da Vinci. Okay, it's like you're trying to capture the Mona Lisa. So it takes a lot. Whoa, we've got a hand in front of the camera. Yeah. Sorry about that. It takes a lot of artistic skill and surgical expertise to do, and you have done this impeccably well. I know how hard this is. I've done it thousands of times, and it's a fabulous job. You're smooth. You had 2 lipos before, and your waist is totally snatched. You're smooth. From a result standpoint, this doesn't get better, and you're still healing.
Yes.
Yeah. So that's pretty amazing. And from a surgical perspective, do you want to talk, Dr. Bullis, about how AirSculpt helps you get through scar tissue?
Yeah, and the other thing I was going to mention too is that the previous procedures involved 2 different types of energy too. She had she had some laser and also ultrasound. So anyone who's familiar with those energy, those produce some scar tissue on top of what you normally get with regular lipos. So
yeah.
And using the AirSculpt, it has a patented motion that's unique, and because of that motion is really what I think sort of tricks your brain into feeling more like it's a tickle. But for me as a doctor, it also means that thing goes like a hot knife through butter. It gets out the fat, and it doesn't care about the connective tissue that's trying to hang on to all that fat. And her procedure itself really opened my eyes quite a bit to the, just the power that this thing has.
Did you use a bucket handle? The needle eye cannula?
Yeah.
That's my favorite.
Yes.
Yeah.
Yeah, it works great. Yeah.
We have a special tool that we connect to AirScope to help take out actual scar tissue. It basically winds it up and pulls it out because these scar tissue fibers, they really look bad. They really present with that lumpy, bumpy appearance, that unnatural look, that roadmap look.
Yeah.
And that's how that's how Dr. Bullis was able to smooth her out, was by using AirSculpt with this tool, and it basically power buffed her. So, and took your waist down to nothing. I mean, it's beautiful. I can't wait to post this. I mean, it's a beautiful result. What else do you want to tell us? Maybe tell us, what would you tell people who've had body contouring before, liposuction, whatever kind of technique has been done, and they're unhappy with the result? What do you think about that?
Oh, I tell them definitely come to Elite Body Sculpture. If you're in Seattle, see Dr. Bullis. He is the best. I mean, I came because I trusted him even before I looked at the pictures on Instagram or YouTube. I just came in, booked the appointment. But I say, if you have had any problems and you're feeling bad, self-conscious about it, like I was, definitely Elite is the place to get your problems resolved and get the body that you want.
Thank you, Karen. Again, I want to reiterate, almost half of our patients have had something done before. Almost half. So this is every day for us, and this is all we do. All we do is fix your contour, is body contouring, making people more happy in their own skin, period, end of conversation.
Yeah.
Dr. Bullis, what else should we know?
Well, I mean, I just think that the other thing I'd mention is the pain. Both during and after, I think is so much better with this procedure. It just faded.
Okay.
And I get by with using much less lidocaine, which is the numbing agent, than I would have used in previous settings. And that's safer for the patient too.
Yeah.
Yeah.
What pain medicine did you take after your procedure, Karen? Did you take ibuprofen?
Ibuprofen.
I love
Yeah.
that.
And it's so nice.
Narcotics. I love ibuprofen.
Yeah.
That's amazing.
Right.
So
Yeah.
And,
you
and I was
basically
gonna say,
took Advil after your procedure. And that's
yes. And I also wanted to say, during the procedure, it's nice because there's no IV,
Yeah.
and you're just relaxed and listen to music, and that just felt so much better than being sedated or being asleep and not being able to see what's happening.
Did you use laughing gas?
No.
Yeah, so she
Use
didn't use the
laughing-
laughing gas.
Just the laughing
So we have
gas,
laughing
yeah.
gas if people are having a little trouble getting through that numbing part,
Yeah.
but she didn't even need that.
No.
I love people being an active participant in their treatment, because then they feel like they have control over. Imagine getting a haircut and being put to sleep and waking up with a
Right.
buzz cut when you didn't want that. So I love people. I want everyone involved in their procedure. I want everyone to feel like they are in control of their result. And having spoken with you before, you were really happy about that, Karen, that before, when you got put to sleep, you felt like you didn't have control, and here being awake. What was it like being awake?
It was actually really nice. It was nice to see the fat being sucked out.
Yeah.
It's also nice because then Dr. Bullis could say, could you move a little to the right, or could you move your arm? And it's really nice because then you can get the desired result. He can work on you, and then he can explain exactly what's happening throughout the entire procedure. Yeah. And I like it so much, I'm coming back again October 1st.
You are, huh?
Yes. I'm gonna get my thighs done and my arms.
I love that's great. Arms are one of my favorite areas because they look pristine, and that skin shrinks up so well. Actually, talking about skin, when I look at your 2-month result here, it looks like your skin has really shrunken up.
Yes.
What do you think about that?
Oh, I love it, because I didn't think my skin would look that good before, and it looks amazing.
AirScope. When I started doing AirScope, one of the biggest I never planned for AirScope to get this kind of skin tightening. I was really surprised, and now it's my favorite thing about the treatment is it really tightens skin well. What have you found, Dr. Bullis, with your patients that you've treated and their skin?
Yeah, I mean, I've been also pleasantly surprised. Skin is always something that is more of an X factor. We don't always have a solid, it's not as predictable as fat removal, I'll put it that way. But our patients, by and large, get very good skin tightening, I've noticed too. Yeah.
I love your skin tightening here. Anything else either of you guys want to add?
I don't think so. I think that's about it from my end.
I just
Have
want
an
to
important
add
question.
I just want to tell for the people that my tennis friends, people who play sports, come in and get this procedure done because you can get back to your life a lot sooner. I really feel that people feel having a surgery like this is going to be the huge downtime. If you do traditional lipo, you'll have that, but not with Airscope. You can get back to your normal life, get back to work the next day, and you'll feel amazing. I mean, I was thinking about it last night. I think I felt like it was a cloud over me, and now the cloud is cleared and the sun is shining, and I feel like a brand new woman.
That's very important in Seattle. Yeah.
Yes, that's very important.
That's amazing. That's why we become doctors. I mean, that's the best thing that I could possibly ever hear. Thank you, Karen, so much. It's an honor to treat you, and I'm so happy you're more comfortable in your own skin, and that we have Dr. Bullis, who's such an excellent artist and surgeon. So thank you both so much for joining us today. And I'm looking forward to. I want to see your arms and your thighs.
Okay.
2 months. Okay.
Yeah.
Maybe
Definitely.
yeah. Thanks so much.
Thanks, Aaron.
Okay,
We
thank
see you
you.
guys later. Yeah.
Take care, guys. Bye-bye. So what we're going to do next is we're going to answer some revision questions, and because we get a lot of them. And I'm just going to kind of go down the list with what we get the most often. Most often questions about downtime. And they ask, what is our downtime? Our downtime is really only 24 hours. So 24 hours after you have your Airscope procedure, you can do basically whatever you want. You can't go swimming. You can't go swimming until your holes are closed. But again, the holes are 2 millimeters, the size of your average freckle. They close in about 2 days. Most people get back to regular exercise in 2 weeks. Sports in 3, just like Karen. And work, usually people go back to work the next day, by and large. And you only have to wear the garment for 2 weeks. So I think Karen wore the garment for months and months. So for us, it's always 2 weeks. And sometimes people want to wear it for another week, and if they want to, it's okay. Another question we get is, do you have to get lymphatic drainage massage or any kind of special after treatment with this? And the answer is absolutely not. You do not have to do that. Some people want to because they like how it feels, and some people think it's going to make them heal faster. I don't think it does, at least not with Airscope. But if you want to get it, you can. It's certainly not a requirement by any stretch of the imagination. If I was going to have Airscope, then I would not get the massage. My fat returned after getting traditional liposuction. How about Airscope? Airscope, as you can see behind me, it took out fat that liposuction could not remove. Any kind of real fat removal is actually permanent. You don't make new fat cells. You can only grow or shrink the ones you have. So it's all about getting a good clean out, getting good sculpting, and taking out all the fat you don't want there. And as you can see behind my head, that's what we do here at Elite Body Sculpture with Airscope. Great question. I've seen traditional liposuction give bumpy lumps. Will Airscope fix this and will it give me a smooth finish? As you can see above, yes, we do this every single day. It's all we do. We do nothing else. So Airscope is here to provide a result and an experience that no human hand can provide. It's not fair. It's robotic. It moves in a way that no one could move their hand or a cannula, etc. But we're actually taking your real fat. We're doing it while you're awake with no needle, no scalpel, and no stitches. How much fat can you take with Airscope compared to liposuction? Funny enough, exactly the same amount. The limit in almost every state except Texas is 5 liters. We abide by that in Texas as well, if that was the next question. But 5 liters is what we take in one day. That can be up to 5 areas. So people say, how many areas can you have done? Up to 5 areas in one day. If you want to have more areas, you can get it as long as it's 48 hours or more afterwards. It's okay. A lot of people just come back the following week for other areas. A lot of people get their whole body done. We do all the way from ankles to chin. What does the scar look like after Airscope? That's a great question. I should have actually asked Karen to show us her scar, but we've showed it many times before in this program. It's either a little freckle-sized dot or nothing. So is Melissa up there? She could show her scar.
I actually have one.
Oh, you
I
do?
have one on my hand.
Why do you have a scar? Okay.
So it's actually not even noticeable. It's right here, guys. It's a freckle. It's pretty awesome.
There you go. So that's what your scar looks like. There's no stitches. There's no drains. Nothing weird like that. I want to make this a spa. It is a spa-like experience, and you just come out skinnier with better results than you could possibly get from any other technology. As you can see, she tried 2 times to get the results she wanted, and now she has it with Airscope. Let's see. Am I allowed to have a friend with me? And the answer is yes. You can actually bring a loved one or a friend with you into your Airscope procedure. They can hold your hand. They can give you Gatorade. I think we're switching to Pedialyte, though, because I like it better. And we're getting some proprietary snacks. That's kind of. Yeah, and they can help DJ the music. The music is one of the most important parts for me during the patient experiences. It just makes it more fun. After being botched by traditional liposuction, how long do I have to wait to be corrected by Airscope? Great question. The answer is 6 months. We need to know what you really look like. We need to get you to a certain level of healing. We need your tissues to have healed enough that we can go in there and take out more fat. So that is a very common question. I'm so glad it was asked, because we have people coming in sometimes 2 weeks after traditional liposuction because they're unhappy, they do the research, they find out about us, they want Airscope right away. We have to wait 6 months. So that's the rule about that. And then the last question, can you fix my Kybella chin with Airscope? We see a lot of people who've had all different kinds of treatments, including Kybella, in the chin and elsewhere. And yes, if you have fat, if you can pinch it, we can take it. So absolutely. That's it for today, and I'll see you guys next week. Thank you so much for watching, and thank you, Karen and Dr. Bullis, for joining us.